5 things to know about COVID this season. 1. The series which is prevalent in India is NB 1.8.1 and LF7, both descendants of Omicron series. WHO calls them variants under observation. They are currently mild but highly transmissible. How do I recognize this? Just presents like any other viral fever, with high-grade fever lasting for up to 3 days, cold, cough, sore throat, body ache, headache, a bit of nausea and tummy pain. When do we worry? If these symptoms occur in the elderly or in those children whose immunity is decreased because of long-standing diseases like asthma, or who are on medication that can compromise their immunity, or if they develop warning signs such as fast breathing. If an infant breathes more than 1 per second, or a preschooler breathing more than 40 times a minute, or a school-age child who breathes more than 30 times a minute is called fast. Likewise, if the saturation measured on a pulse oximeter at home is less than 95%, if a child's fever is not coming down despite medication or is lasting for more than 3 days, child develops vomiting, is very dull and drowsy, please contact your doctor. What can I do at home? First thing is ensure the child is well hydrated. Use ORS, tender coconut water, soups, kanji, etc. Make sure fever medicines are given when the temperature is above 99.5 and the child is uncomfortable. Also give them cold and cough medicines, especially if it is disturbing their sleep or their feeding routine. These are all called symptomatic medicines. What should I not do? I should avoid using antibiotics like azithromycin because they do not work for viral infections and can increase harm. Secondly, I should not send my child to school or daycare, especially when they're having active symptoms. This is reinforced by our Chief Minister in today's paper. What can I do now? I should ensure that young children and elderly at home are vaccinated against flu because that is something entirely preventable and is prevalent today in Bangalore. Secondly, I ensure that all members in my family are having good lifestyle practices because a healthy lifestyle is the best vaccination against COVID and any other viral infection. So stay safe, happy and healthy.
Hi, this is Dr. Sheetal, consultant physician at DHEE hospitals. As the monsoon sets in, the viral illnesses also boom in. Let me talk about certain flu-like illnesses, particularly about the COVID-19. What are we expecting and what do the patients present with COVID-19 infection? They usually present with a fever, cold, cough, sneezing, running nose, body pains, headache, excessive tiredness, sometimes loose stools, loss of taste, and loss of smell. What are we supposed to do after this? First thing, please do not panic. There is medical assistance available. Seek medical help at the closest medical center, either via telecommunication or via in-person visit. What are we supposed to look for? Look for fever. By fever, we mean any temperature beyond 98.6 degree Fahrenheit during the first half of the day, a variation of 0.5 degree higher during the second half of the day. When you have fever and the symptoms mentioned above, you have to visit the medical help. Remember that 90 to 95% of these patients do not need hospital admissions. They can be managed by symptomatic treatment. At home, what are we supposed to look for? Monitor your temperature at least thrice daily or once in every second hourly, which is most preferable. Look for saturation. If you are not able to hold saturations at least 94% on room air, or if you are suffering from any air hunger, breathing difficulty, or experiencing poor oral intake, dizziness, continuous vomiting, seek medical attention immediately. What else are we supposed to do apart from this? Isolate yourself the moment you get to know that you are suffering from some flu-like symptoms. Do not attend public gatherings or any public places which are crowded. Use masks, use hand sanitizers, wash your hand more frequently, and follow the respiratory hygiene, that is the cough etiquette. By that we mean when you cough or sneeze, please do so in the angle of your elbow so that you can prevent the dispersion of respiratory droplets into the environment, thereby preventing your near and dear ones from catching this virus. Follow these basic awareness points and stay safe and stay healthy. For more such information, please contact me at DHEE hospitals and this is my number. Thank you.
Hi, I am Dr. Srinivas, internal medicine consultant from DHEE hospitals. As we all know, the number of COVID cases are rising throughout India as well as in Karnataka. The current variant which is spreading is known to be Omicron subvariant. The severity of the current variant is not yet known or confirmed. But since the transmission of the virus is considered to be very rapid, we better take some necessary precautions. And the precautions are like frequent hand washing and avoid going outside in crowded places or wearing masks when we are going outside in crowded places. Coming to the symptoms are common like any other flu, like fever, cough, cold, throat pain, body pain, headache, and severe myalgia. Some patients may complain of vomiting, loose motions, and in some cases, loss of taste and smell. Coming to the testing is not recommended for all the patients as of now, but it has to be done in some immunocompromised and elderly patients. Immunocompromised patients like patients who are receiving chemotherapy for cancer or radiation therapy, or the patients who are taking long-term steroid therapy, and the patients who are having long-term lung issues or liver issues or renal or any kind of heart related ailments. No need to worry or panic as of now related to the current ongoing COVID infection. For more information, you can contact me in the hospital and the number is provided here. Thank you.